The most dangerous time to take your blood pressure medication. If you take your blood pressure medication with your morning coffee, you need to stop what you are doing and read this. If you take your water pill after 2 p.m., the same applies. And if you have ever doubled up after missing a dose, I need to talk to you. What I am about to walk you through is what your pharmacist should have told you the day you filled that prescription. The most dangerous time to take your blood pressure medication. After working with thousands of patients on blood pressure treatment, there is one timing mistake I see every single week that most doctors never address in a 15-minute appointment. If you take your blood pressure medication in the morning or at night without understanding these specific rules, you may be cutting its effectiveness in half. Or worse, you may be opening up a dangerous window in which your heart and kidneys are left completely unprotected. What I am about to share is what I tell my own patients once the prescription has already been written. The conversation that does not happen in the exam room. Stay with me, because timing mistake number 3 is the one that catches people most off guard. My name is Dr. Dan Carter. Blood pressure medication is one of the most widely prescribed drug classes in the United States. And most patients are told what to take, but not when, not with what, and not what to steer clear of. That gap in information is costing people their health. Today I'm going to walk you through the 5 most dangerous timing mistakes I see with blood pressure medications. The ones that create real cardiovascular risk, undercut the effectiveness of the drug, and sometimes trigger emergency complications. And I will tell you exactly what to ask your doctor or pharmacist before your next dose. Mistake number 1. Taking ACE inhibitors and ARBs in the morning by default. Let me start with a class of blood pressure medications most older adults are on: ACE inhibitors and ARBs. Drugs like lisinopril, ramipril, losartan, and valsartan. These are prescribed to millions of people every day. For decades, the default instruction has been, take once daily in the morning. That was a convention, not necessarily an evidence-based decision. But research has shown that patients who took their blood pressure medication at bedtime had significantly better cardiovascular outcomes than those who took it in the morning. Lower rates of heart attack, lower rates of stroke, lower rates of death from cardiovascular causes. Why? Because blood pressure follows a natural rhythm. It dips during sleep, then surges sharply in the early morning hours. We call this the morning surge. That surge is the window in which heart attacks and strokes are most likely to occur. A medication taken at bedtime is still active during that vulnerable morning window. A medication taken in the morning may have already peaked and started to decline. This is not a minor optimization. The difference in cardiovascular outcomes between morning and bedtime dosing is clinically meaningful, and yet the default prescription instruction, take in the morning, has not changed for most patients. I want to be honest with you. The science on this is still evolving. Some studies show a clear benefit to bedtime dosing. Others show no significant difference. The right answer depends on your specific medication and your specific blood pressure pattern. What I tell patients: ask your prescribing physician, should I be taking this at bedtime instead of in the morning? That one question is worth asking. If they can give you a personalized answer, great. If they have never even considered it, that tells you something too. Mistake number 2, drinking grapefruit juice with your medication. This one surprises people every single time. I have had patients who were doing this every morning without any idea it was a problem. Grapefruit and grapefruit juice contain compounds called furanocoumarins. These compounds block an enzyme in your digestive system called CYP3A4. That enzyme is responsible for breaking down many blood pressure medications, specifically calcium channel blockers like felodipine, nifedipine, and amlodipine. When that enzyme is blocked, your medication does not get processed normally. Blood levels of the drug climb dramatically, sometimes to dangerous heights. The result? An exaggerated drop in blood pressure, dizziness, fainting, and in some cases, dangerous arrhythmias. Here is what makes this particularly serious. The effect of grapefruit can persist for 24 to 72 hours after you consume it. This is not just about the moment you eat it. A glass of grapefruit juice in the evening can affect your medication the following morning. If you take any calcium channel blocker for blood pressure, ask your pharmacist directly. Is grapefruit a concern with this specific drug? Do not assume the answer is no. Ask. Mistake number 3, taking your diuretic too late in the day. This is timing mistake number 3, and it is the one that surprises people the most, because it is not about drug interactions or food. It is about something much simpler: and the consequences are serious. Diuretics, or water pills, are one of the most commonly prescribed components of blood pressure treatment. Medications like hydrochlorothiazide, furosemide, and chlorthalidone work by making your kidneys excrete more fluid, which lowers blood volume and brings pressure down. The timing problem is this. Many patients are taking their diuretic in the late afternoon or evening, sometimes because they forgot their morning dose, sometimes because they were never given specific timing instructions. When a diuretic is taken too late in the day, you get the predictable consequence: frequent urination at night. Most patients accept this as normal. It is not normal. It is a preventable side effect of incorrect timing. And here is what I want you to understand about why this matters beyond just disrupted sleep. Every time an older adult gets out of bed in the middle of the night, in the dark, sometimes disoriented, with blood pressure that may shift when they stand, the risk of a fall climbs significantly. Nighttime falls in older adults are a leading cause of hip fractures. Hip fractures in patients over 70 carry a one-year mortality rate of 20 to 30%. That is the real consequence of taking your diuretic at 6 p.m. instead of 8 a.m. The rule I give every patient: if you are on a diuretic, take it in the morning, ideally before 10 a.m., so that the peak effect runs through the day, not the night. If you are on a twice-daily diuretic, the second dose should be taken no later than 2 p.m. Mistake number 4, taking your beta blocker with coffee. Most people who take beta blockers, medications like metoprolol, atenolol, carvedilol, and propranolol, take them in the morning. And most of those people have their morning coffee at the same time, or shortly after. Here is what is happening inside your body when you do this. Caffeine is a stimulant. It activates your sympathetic nervous system. It raises your heart rate and temporarily lifts your blood pressure. Beta blockers work by blocking that exact sympathetic activation, slowing the heart rate and reducing the force of heart contractions. When you take a beta blocker at the same time as a significant amount of caffeine, you are simultaneously pressing the gas pedal and the brake. In most patients, the medication wins. But in patients with certain cardiac arrhythmias, the combination can trigger palpitations or irregular heartbeats during the period when caffeine peaks, roughly 30 to 60 minutes after ingestion. There is also evidence that caffeine can interfere with how certain beta blockers are metabolized, particularly metoprolol, in patients with specific genetic variants affecting drug processing enzymes. My recommendation? If you are on a beta blocker for blood pressure or a heart condition, wait at least 30 to 45 minutes between taking your medication and your cup of coffee. It is a small change. For patients with a history of arrhythmias, it may be clinically meaningful. Mistake number 5, doubling up after a missed dose. This is the timing mistake I see most frequently, and the one with the widest range of consequences, depending entirely on which medication you are taking. A patient misses their morning blood pressure pill. They remember at noon, or at 3 p.m., or at dinner. The common instinct is, I'll just take 2 tonight to make up for it. For some medications, this is relatively low risk. For others, particularly calcium channel blockers, certain ARBs, and beta blockers, doubling a dose can cause a sudden, significant drop in blood pressure, dizziness, fainting, and in older adults with reduced vascular tone, a fall. There is a second version of this mistake that I see just as often. Patients who are prescribed twice-daily medications start taking them once daily because it is easier to remember, often without telling their physician. The blood pressure is partially controlled. The physician sees numbers that look acceptable. The medication dose is never adjusted. And the cardiovascular protection the patient should have is incomplete. The standard guidance is this: if you miss a dose and it is still the same day, take it as soon as you remember, unless it is close to the time of your next dose. In that case, skip the missed dose and resume your normal schedule. Never double up without first asking your physician or pharmacist, because the answer depends entirely on which medication you are taking. A word before we wrap up. I want to be clear about something before we finish. Blood pressure medication saves lives. The evidence for treating hypertension is among the strongest in all of cardiovascular medicine. I am not telling you to stop your medication. I am not telling you your doctor made a mistake. What I am telling you is that the conversation about timing, about when you take it, what you take it with, and what happens if you miss a dose, is a conversation that often does not happen in a 15-minute appointment. And that gap in information has real consequences for real patients. 5 questions to bring to your next appointment. If you are over 60 and taking blood pressure medication, or if someone you love is, here are the 5 questions to bring to your next visit. Should I be taking my medication in the morning or at bedtime? Are there foods, supplements, or drinks I need to avoid around my dose? What should I do if I miss a dose? Is there a specific time of day when my blood pressure tends to be highest? Are there any timing interactions with my other medications? Those 5 questions, asked clearly, will do more for your cardiovascular protection than anything I can tell you in an article, because your physician has access to your full history. I do not. But I can give you the questions. I am Dr. Dan Carter. This is the conversation that should have happened in the exam room. Take care of yourselves. I will see you in the next one.